Carbon dioxide angiography is done by using carbon dioxide injection into the blood vessel. Usually, iodine containing radiocontrast dyes are injected into the blood vessels and continuous X-ray imaging done to obtain angiograms. Contrast material is needed to visualize the blood vessels separately from the other body tissue. But usual iodinated radiocontrast dyes have a potential risk of causing acute kidney injury. This is more so in those with already impaired renal function. It is in this situation that carbon dioxide angiography is usually considered. Usual angiograms appear dark while carbon dioxide angiogram looks grey because of the lower density of carbon dioxide compared to tissue. Conventional angiogram is shown beside the CO2 angiogram for comparison of opacification. Please note that the angiograms are not in the same projection. The better contrast with conventional angiogram is obvious. While conventional angiograms look like positive images, carbon dioxide angiograms look like negative images. Earlier, those with renal issues were considered for magnetic resonance angiography, which was also called dye-less angiography. This is because blood vessels can be visualized in MRI with the contrast obtained from moving hydrogen nuclei in water, an important constituent of blood. But for better visualization, gadolinium-based contrasts are often used in magnetic resonance angiography. Gadolinium-based contrasts have been associated with a condition called nephrogenic systemic fibrosis in those with renal failure. Nephrogenic systemic fibrosis is a condition resembling scleroderma with thickening and darkening of large areas of skin. The disease can also involve multiple organs of the body sometimes. Hence, the role of carbon dioxide angiography in those with renal dysfunction, as carbon dioxide is devoid of any such toxicity. As carbon dioxide is highly soluble in blood and rapidly cleared from blood, it is ideally suited as a negative contrast agent in those with renal failure. But the technique of carbon dioxide angiography is a little cumbersome than usual contrast angiography. We need a medical grade carbon dioxide cylinder, three-way stopcocks, connected tubings, syringes, and a reservoir bag for interim storage of carbon dioxide. Carbon dioxide angiography is an alternative in those with contrast allergy, as carbon dioxide is non-allergenic. Carbon dioxide angiography should not be used for cerebral angiography, and injections should be below the level of the diaphragm. That would mean that carbon dioxide angiography cannot be used in the upper part of aorta or for coronary angiography. Carbon dioxide angiography has also been used to guide angioplasty procedures in abdomen and in the legs. Some complications have been reported with carbon dioxide angiography due to formation of vapor lock within the blood vessels. Bleeding at the blood vessel puncture site can occur in carbon dioxide angiography as in conventional angiography. This is prevented by giving good compression after removal of the injecting device. Complications can also be due to contamination with room air, which contains nitrogen in plenty and can produce airlocks within the blood vessels. Use of a good airtight system and meticulous attention to technique can reduce the complications.